on YouTube. Hey, welcome everybody. This is the favorite day of the week. This is How to Pass NCLEX. I am so happy that you're joining me on YouTube. I am also so happy that we have our ReMar nurses from all over on Facebook as well. We are getting started right away. You know, I love Mondays because we have the opportunity to do medical surgical NCLEX questions. We also get into that critical thinking. We make sure that you guys understand, hey, it is what it is because of the content. Hello, everybody, come on in. Hey, our motivation for this Monday is the topic, no fruit. And so we are starting at an alternate time because I am joining you right from our home. You guys know yesterday, if you follow me on Instagram or if you're on Facebook as well, we did a story because I did my gender reveal yesterday. So I hope you got the chance to see what Mark and I are finally having for baby number 3. If you know what it is, go ahead and put it on the screen. Let everybody know. But yeah, we'll be broadcasting right from here, our home, but we have the same great NCLEX information. So Texas is in the house. I meant Florida, Minnesota, Puerto Rico. I'm so happy to see you all here. Thank you for joining me. North Carolina as well. Oh yeah. All right. So yep, we are getting right into it. Oh, I cannot forget that ReMar Nurse University, we're wrapping it up. We are wrapping it up on tonight. So make sure that you are in attendance for the final class. Yes, it's coming to an end, but you don't want to miss it. We're going over some NCLEX questions, so it's going to be fire. All right. The NCLEX virtual trainer, the sale also ends this Friday. I know some of you said, I'm buying it, I'm getting it, but this is the best product I've ever created for nursing students to help them pass. So if you don't have your VT, again, this is the final week for the sale. Check it out at remarnurse.com. Tell your friends so they don't miss it as well. We got over 7,400 nurses studying together. Oh, yes. For our ReMar virtual trainer. And so it is a very lively group in there. Yes, you guys rock. Absolutely. I also see Philly is in the house. I'm glad that you're representing Philadelphia right now. And yes, it is a girl. So Candace, I feel you. We're going to get next questions. And then at the end, we can chat. Go ahead and if you have any comments about the virtual trainer, ReMar Nurse University, anything else, we will be discussing that at the end of these NCLEX questions and our motivation. So let's go. Question number 1 simply says this. A client arrives at the emergency department trauma unit by ambulance after a motor vehicle crash. The nurse recognizes which symptoms of shock in the client. Okay. And we're going to select all that apply here. So we're looking for signs of shock in the client. Is it number 1, respiratory rate of 16 breaths? Urine output. This is number 2. Urine output of 90 milliliters in 1 hour. The mean arterial pressure of 58. Okay. 4, client pulling at lines and tubes. And 5, heart rate of 115. Okay. All right. So we're looking for signs of shock here. We are looking for signs of shock, and this is a select all that apply. So I should tell you guys that you have the opportunity to put more than one answer because I'm seeing a lot of just one answers. So make sure that you're putting more than one answer, but we're looking for signs of shock. We're looking for signs of shock here. Okay. All right. And you guys might be surprised. You guys might be surprised at this answer here. All right. So signs of shock. Okay. All right, here we go. The correct answer is going to be right here, pow, 3, 4, and 5. 3, 4, and 5. 3, 4, and 5. Okay, so let's go over the rationales for the correct answers here. We're looking for signs of shock. Signs of shock. So 3, the mean arterial pressure is irregular. A lot of people got that. Mean arterial pressure is 58 here. Normally it's between, 70 and 100. I think you at least want it to be 60. So here we have a below the normal range. So it may indicate shock. Confusion lets you guys know that your oxygenation problem could be present. All right. It also could be a sign of shock. When patients go into shock, they do get confused. So if they're pulling on lines and tubes and things like that, that could be a possible indication. Yes. And then tachycardia, of course, is a sign of shock, because when the blood pressure drops, then the heart rate will go up to compensate for that blood pressure. All right. And so these are the signs of shock. The respiratory rate of 16 is considered what? Is that irregular? No, not at all. And then number two says a urine output of 90 milliliters an hour. Thank you for just joining in. Well, we know minimum urine to be, right? We want the minimum to be about 30, right? So if somebody has more than that, that doesn't necessarily indicate a problem. That honestly could be that they have adequate perfusion of the kidneys, right? So if somebody's putting out 90 or 100 an hour, that does not indicate that there's an issue. Actually, depending on how much fluid they had before, it could indicate a very normal functioning kidney. So we would not consider 90 milliliters in 1 hour to be a sign of shock. All right. Okay. Let's do number 2. Let's do number 2 here. Number 2 says this: the client with a blood glucose level of 192 requires 4 units of insulin aspart from a flex pen. The nurse performs which action to administer insulin aspart subcutaneously to the client? Okay, insulin aspart pen. Is it number 1, clean the injection site with soap and water? 2, insert the needle at a 30-degree angle? 4, roll the insulin between the palms to mix? Or 4, attach a new needle and prime with 4 units, and prime with 4 units. So let me just do this, because I see here that this needs to be corrected in my slide. So I'm just gonna do it really quickly here. It should say attach a new needle and prime with 4 units instead of 2, because she's giving 4 units of insulin. So looking at the question here, I want you to put your answer on the screen. Okay. Put your answer on the screen. Okay. So we're talking about the flex pen here. And this wasn't one that I had went over when we talked about insulin administration during ReMar Nurse University. So I'm putting it on here to challenge you. I actually did get this one. I modified it from the question bank that I'm working on for you guys. And I saw some comments about it. So we'll talk about that afterwards. But yeah, it's looking. So now that I corrected it, which one would you guys say that it was? Even still, I see a lot of people picking 3. Not too many people picking 1, 2. So it looks like it's between 3 and 4 now. So the correct answer, and remember guys, with the flex pen, you have to about the flex pen. What kind of insulin is in the flex pen? The flex pen will tell you what is in it. So here, the correct answer actually is 4. That's why I had to make that modification, because you do, when you use a flex pen, you do change the needle on that flex pen, right? So you have to make sure that you're putting a new needle every time you use it, even though the insulin will stay. Okay. You have to make sure that you're putting a new needle, even though the insulin stays. And you have to calibrate it or prime it every time that you use it. So did you get that one right? Yes. Okay, perfect. All right, let's do number 3. Yeah, the medication is already in it. You just need to put a new needle on it. All right, let's do number 3. This is a safety question. If my practical nurses are watching this, you will want to make sure that you pay attention. The registered nurses, you definitely need to know this one as well. All right. So the question is this. The practical nurse is setting up a room for admission. Which equipment would the nurse remove from service and then notify maintenance? Okay. So we're looking for equipment that we would take away from the room. Select all that apply. So number 1 says a bed that is missing a rail, but is still usable. Okay. 2, an IV pump with a current safety inspection sticker. Shout out Kevin, just passed his NCLEX last week. All right. 3 says a rolling recliner with all wheels in the fully locked position. 4, a new extension cord that a previous client left behind. All right. Or 5 says a feeding pump with a frayed electrical cord and a current safety inspection sticker. So we're looking at the things that we would remove from the room, things that are not safe. Oh, and this is a good one because I love it. It's select all that apply. So you got to get all of them right. And I'll definitely give you a hint towards it. And remember, if you guys, we're doing the NCLEX portion questions. So, so you got to be in your critical thinking mode right now, So the correct answer here is going to be, most of you got it right. No, most of you did get it right. It's this. It's 1, it's 4, and it's 5. A lot of people had just picked 1 and 5, and they left that number 4 out. So let's just go over it. For number 1, extension cords are a no-no. Extension cords are a no-no with hospitals, okay? Extension cords are a no-no with hospitals. Why? Because they pose a safety risk. So patients can fall and trip over the extension cord. Okay, so even if it says that it's new, you cannot use that safety cord. You cannot use that extension cord at all. All right. Also, if you have number 5 is just a frayed electrical cord, that's not going to be great either at all. Anything that's frayed or exposing wires. Okay. Yes, that's right. Michael says the nurses can trip too. Absolutely. The nurses can trip too. Lauren, did you get that one right? You did. All right. That's like, this was not right for another reason. If you picked it, I'm okay with it. This is the rationale behind it though now. All right. Let's do another question, shall we? All right. Our next question is this. It is question number 4. A client arrives in the emergency room. I like the emergency room scenarios this week. With intense right lower quadrant pain, okay? And the nurse reports which laboratory result to the healthcare provider. So we got number 1, WBC of 21,000. We have 2, a lactic acid level of 1.8. We have 3, a CO2 level of 35, or we have a hemoglobin level of 11.1. So here, which one are we going to report? Which one are we going to report to the health? And I really want to see what you guys are critically thinking about. Hey, and I'm looking for somebody to give me like some controversy, but you guys all are. It's like everybody got this one. Somebody was like, I think. Somebody was like, I got it right. I'm not sure. Shout out to Nurse Laguel. Am I saying it right? I finally passed NCLEX 10 years. All right. First time. She says, the first time I knew it was right. When I was answering, it was right. That's amazing. BT made the difference. Awesome. Awesome. Okay, so I thought this one would be challenging for you guys, but it actually wasn't. So everybody seems to have gotten it right here. And of course, the patient had what? The patient had this pain in a very specific area, right lower quadrant pain. So everybody picked number 1. You guys picked number 1, which of course, this normal white blood cell count is between 4,500 and 11,000. Were you guys confused at all about the other laboratory values? I know I have some nursing students in here who haven't graduated yet. Did you get this one right? I hope you did. So I thought it would be challenging for you guys. Sometimes the new trend with NCLEX questions is to put several abnormal values in a one correct or single correct answer NCLEX question. And then so the way that the students would get it right is by using the context clues from the initial statement or the client presentation to pick which one that they should actually report based on what they've been told about the client. So yeah. So somebody's like, yeah, I thought that was right. So number four, the hemoglobin level was low. All right. It's absolutely low, but the client comes in with right lower quadrant pain. And so you have to be thinking, number 1 is more critical too. Yes, Stephanie. So you have to be thinking, okay, this indicates some sort of infection, appendicitis, maybe something else, we don't know. But yes, the hemoglobin is not going to be the priority over a low hemoglobin level, because when I look at low hemoglobin, if your patient has a low hemoglobin level, what should you be thinking? What could be the related diagnosis, or what could be the treatment? That's what you got to think. Like, what's the treatment? All right. Yes, Lauren, if more than one abnormal, go back to the question and see the signs and symptoms and what they're asking. Absolutely. Because then that helps to demonstrate that you have critical thinking. That helps to demonstrate more than critical thinking, that you have clinical judgment, right? And everything is clinical judgment now. And so, Selena, you're right. If my patient has a low hemoglobin level, then I'm thinking anemia, right? I'm thinking their iron is low. And so I know the treatment for that right now at an 11 is probably going to be iron supplements. It's not going to be blood right now. Remember, we talked about giving blood. We usually give blood if the hemoglobin is below 7. So we have a showdown here between infection or anemia. And I'm spending some time on this because, like I said, when you're taking your NCLEX exam, you may see it in a different presentation. It might be a showdown between diabetes mellitus 2 or shock. All right. And so I need you guys to, think, okay, if my patient has a blood sugar of, 170, or I have somebody with a low blood pressure and tachycardia, I have 2 abnormals, but which one is more critical? All right. And you guys know that you're taking this modified NCLEX. And so you really have fewer questions to demonstrate correctly that nursing. All right. So yes, so you guys are really getting into it, putting medication names down and all these things to treat anemia. So I love it. All right, let's do another question here. Here we go. We're gonna get into it. Question number, oh no, let's do this one. Question number 5. Here we go. Question number 5. A nurse instructs a client taking propylthiouracil to reduce dietary sources of what? To reduce dietary sources of what? Is it number 1, vitamin K, 2, iron, 3, iodine, 4, calcium? Okay, here we go. This is content right here. Okay, I see a lot of number 2s going on. A lot of people thinking it's iron. A lot of people thinking it's 3 or 4. Actually, this is a mixed bag. Oh my goodness, this is a mixed bag of answers. So I guess we have to start with, do you know PTU? Do you know PTU? And if you're doing this question, hey, Dan says, thank you, ReMar, I passed. Shout out, tell me what you passed. Are you an RN or are you a PN? Okay, somebody says 4. You have to ask yourself, hey, do I know this? Anybody in the virtual trainer that has done the endocrine portions and the thyroid review, you better know this, okay? All right, that's all I'm saying. That's all I am saying. All right. Some people were like, I'm sure that of my answer. Some people are not sure, but that's why we come. And like I said, it is better for you to get it wrong here. It's better for you to get it wrong here than to get it wrong on your exam. So this is why we come here, to show up and we study. Okay. So the correct answer, shout out, we got almost 1,000 nurses. Okay. We got almost 1,000 nurses studying here. The correct answer is going to be iodine. Absolutely. Okay. Iodine interferes with the effectiveness of PTU and levothyroxine. Okay. All right. So you guys have to know, when we talk about pharmacology, there isn't a lot of pharmacology that you have to be fluent in, but there are some major ones. VT's on point. When you talk about medication and you talk about healthcare, especially in Western medicine, it's very institutionalized. So what I mean when I say that, and I think this is one of the things that you learn as a nurse, the longer you become a nurse, you have 2 people that come in, and honestly, if I'm there, I'm in the hospital for a myocardial infarction, and then you come in with the same diagnosis, we are pretty much gonna get the same treatment. We are pretty much going to get the same protocol. We are pretty much going to get the same medications. And so because this is the way we conduct our healthcare here, then for state boards as nurses, there are generally medications that you have to know because everybody will be prescribed them. Okay. So, propylthiouracil is one of them. You guys know levothyroxine, Synthroid, right? These are medications that when it comes to the thyroid gland, there are certain medications that are extremely popular and they give them to everybody. All right. So that's what we focus on with our pharmacology. And I don't have my quick facts book, but you guys know in the back of quick facts, the top 100 medications are there to study. And these are the most popular medications based off the current practice analysis and what we are generally prescribing in hospitals. So study those. Also, I know it's not right, okay? I know it's not the way healthcare should be, but it's the truth of the matter, all right? We want healthcare to be very individualized and things like that, but pretty much the medications are for everybody, okay? All right, so those are our NCLEX questions. Don't forget, this is the last week for the virtual trainer sale, 75% off. Somebody asked, how much was it? Bam, there's the price. It is dropping down, $149. Okay, and listen, next week when the sale is over, don't be shocked if that price goes up. All right, that's all I'm saying. Our NCLEX motivation is no fruit. But before I do the motivation, you guys know I have been hitting you with that, the latest ReMar nurses who are passing. The first one is Nurse Gina. She got her ReMar roses. I love it. Okay, I love it. Story time. She says, I had a job waiting for me, but I still had to pass NCLEX and time was running out. The buck stopped with me. I am the only source of support and income for my family. That's deep. Regina's mantra, I can, I will, I must pass NCLEX. NCLEX has my name written all over it. I ordered the virtual trainer and absolutely loved it. I watched the first 3 videos and my Lord, it was so easy to understand. All right. It's like I didn't want to walk away. I was already using UWorld before I found out about the VT because that's what everyone was using. But the VT made the content stick. So I used the VT for all of my content and UWorld for the supplement. When COVID hit, I messaged Regina to see if she would offer free extensions for students, and I was able to get a lower renewal price of $69. She says, I let my VT account renew once because of all the cancellations and date changes with COVID, but I'm happy to say I took my NCLEX and I got my test results Thursday, and she passed her NCLEX exam. So amazing, amazing, amazing. She says, hashtag new nurse, hashtag loving mother. And then who is next? Who is next to pass their NCLEX? I love it. Also, Nurse Clark, let me tell you her story. She said, I was desperate to pass NCLEX. One of my classmates recommended ReMar for NCLEX. So I came to the Facebook page, just saw the passing rates and all the great information. I had already failed boards and began studying again with the Quick Facts book that my friend gave me. I was hoping that if I studied it, I would be ready. I didn't know what I was doing wrong, but each time I kept getting a bunch of follow-up questions. I was desperate for help. I messaged Regina, ordered her NCLEX virtual trainer for content. Check this out. I finally passed my 5th time. I finally passed NCLEX my 5th time. So wherever you are with retesting, this was her 5th time and she passed it using the NCLEX virtual trainer. Thanks, Regina, so much. Nurse Clark, new nurse, ReMar nurse, hashtag LPN, who is next. And here's our final one for today. You got to listen to this. It's awesome.
Everything that I studied in the virtual trainer is in these questions. Exam next weekend. Pray for me, ReMar family, that I will have all of the tools that I need to pass that exam. And it all came from this one resource. The virtual trainer is just, it's everything that you need. It really is everything that you need. She definitely went into a lot more depth. She's a godsend book. So what's nice about the virtual trainer is just that everything is in one place. And that to me was one very big pro. I really liked that everything was in one place. The other thing about the virtual trainer is just that, like, I don't know what other people are saying, but I found that there was way more content. Like, I mean, people have been passing with this since the beginning. So it is also a very wonderful resource. I would say that for me and the way that I learn and the fact that I'm not a patient person, so I need everything kind of in one place, the virtual trainer was a better option for me. But all of the ReMar resources are amazing, and they will be what makes you pass this exam, because we can, we will, and we must pass NCLEX.
Okay, and I just wanted to give you the update because when she did the comparison video, she had not taken her NCLEX. So she sent me a message, and 2 days ago she said, "Third time really is the charm because I passed my NCLEX RN. This journey was a huge lesson in faith over fear." Some of us need that lesson, but with perseverance, resilience, and most important, the grace of God, I did it. ReMar is the truth. The VT was exactly what I needed to solidify my content knowledge. Thank you, Miss Regina and Mark. God bless you for your tireless effort you put forth to educate new nurses and lead them to success. I love new nurses. Not only did I get my license because of ReMar, but the words of inspiration you two shared inspired me to have a stronger relationship with God. Oh my goodness. She says, "Thank you. I am honored to be able to refer to myself as Sutherland RN." That is beautiful. Sutherland RN. I love that. So hi everybody, I'm Callion RN, and I can't wait until you can say that, those letters behind your name too. I just wanted to shout out to Nurse Palmer. She came through with a praise report. She did send her video. I think we'll be showing it next week for sure. Says, tried hers, didn't work. Tried to self-study, didn't work. Tried again. God blessed me with the VT. And now look at me, 130 questions later. And finally, a ReMar nurse as of 6/10/2020. And she did send me her testimony. Hashtag thank you, ReMar. Thank you, Regina. All right. So I loved Nurse Palmer's story. You gotta hear it. She's a new mom, and it almost had me in tears this morning. So, all right, motivation for today is no fruit. It's no fruit. And it's simply, it reminded me of this here. And it says, the tallest tree in the world is as good as dead without water. Okay. The roots are important to support growth. Okay. And that should say something to you guys here. You can, on the very surface, be as grand and as good looking and as perfect as anything, right? We see it all the time. People on TV, celebrities, look beautiful, they look happy, but in their real life, where are their roots? They don't have anything rooted in anything. And so although they appear to be successful and happy on the inside, because of a lack of roots, they're what? They're empty, they're sad, they're miserable, right? And so I wanted to remind you guys, the roots you develop now will determine the fruit you have in, okay? You will not be able to produce any fruit. And so we all want the fruit of passing NCLEX and getting our, this is a fruit, having this wonderful career where you work when you want to, you work for however long you want to, you travel, you do all these things. But what you do now will determine if that's the kind of fruit you're going to have. Because if you're not digging down and having these types of roots, and these are the roots that I said that you really need, sacrifice, knowledge, okay, common sense. I mean, common sense is the biggest thing of them all, right? Discipline, passion, and skill. These are the roots that an individual needs to have, particularly to be a nurse in today's world. You have to have all of these things in order to be able to produce the kind of fruit that demonstrates an amazing career in nursing. And if you lack any of these areas, all right, whether it's discipline, knowledge, sacrifice, common sense, passion, or skill, it will be a very, very, very tough road. Okay. It will be a very, very tough road for you. Nursing is not a superficial profession. Nursing is not a superficial profession. And I'm not going to even call out like professions that I think are superficial, because I don't know what it takes anything else. I don't know. I'm a nurse. Like, that's what I'm trained to do. But I do know one thing. The days in nursing are hard. Okay. There are some times where you will feel abused. There are some times where you will feel exhausted mentally before you even start your shift. Just the idea, just the idea of going in and being solely responsible for meeting the needs of another human being, right? That it may be in very critical condition. To have the responsibility that you have to do everything right for the next 12 hours. You cannot make any mistakes. And not just for one person, but for 4 people or 5 people. You have to do everything right for them. It can be extremely exhausting. You guys know it. You guys know it. And it's so different. It's so different when you're a parent, because you think, okay, I'm responsible for my children. I'm responsible for, taking care of my parents or my grandparents. It's totally different, because with them, you have sort of a grace, right? You have a sort of a grace with your children. But if you mishandle the care of a patient, you could be sued. You could lose the very thing that we're working on, your license, right? And so you have to do everything in your power to protect your product. And I keep telling you guys, your product is your nursing license. And so you have to treat it like that. It's the most valuable thing. It's the most valuable thing that you have. And somebody says, yes, common sense is not common. No. And there are some people that will lose their license just because they failed to exercise common sense. All right. So you have to have that. I mean, you can't be, dating your patient, things like that. I guess that's another issue. But they're just things that common sense, you can't do it. You cannot go on dates with the patients. You should not, you guys. That's all I'm saying. These are the 6 things that you need. All right. And these are the things that you could be working on today. Okay. These are the things that you can be working on right now to really produce those roots. And Sharon says, let me see. Sharon says, yes, times are rough working with the LPN. Farah says, thanks to ReMar, Regina and Mark helped me pass my NCLEX last August. Everything changed drastically in my life. Since then, I'm now a bone marrow transplant nurse with already 2 certifications earned. Wow. Congratulations. You have a specialty. Worked in the oncology center in Chicago. I am favored by God indeed. Thank you, ReMar. Awesome. And so that's what I mean. The license that you guys will get is really just a stepping stone. It's really just the first product that you have to offer. And then when we go on, we get those certifications, we get those specialties, and you guys become experts in the field. But I know somebody can back me up. There are going to be some hard days during that time. And so if you don't have the roots of faith, if you don't have the roots of passion and sacrifice, then it's going to be extremely difficult. Okay. So that's my motivation, knowing that the roots are going to uphold you guys. All right. Going to uphold you guys. And just a reminder. Well, you know what? Just a reminder, the final class of ReMar Nurse University is tonight, Monday at 8:00. And so we plan to do that 8:00 Eastern time. We will be going over some NCLEX practice questions. They are going to be from all disciplines of nursing. All right. So we're going to go over some psych, some management of care. All these things will happen tonight at 8 p.m. Eastern time. And again, the virtual trainer is going to end next week. All right. And I saw so many questions about the VT. So let me see. So somebody is asking about the virtual trainer, the renewal. So if you renew the virtual trainer, you do not have to pay the initial subscription price. The renewal price is just $69. Okay. Also, if you have the virtual trainer, if you don't have the virtual trainer, but you have the quick facts, then the price drops from the $149 to the $129. Okay. The $149 to the $129. All right. So those were the questions I had. Somebody, Prudencia says, so happy I have the VT. All right. Rosie says, so the quick facts is the study guide and the virtual trainer also has videos. Can you do one without the other? All right. Help me answer, Rosie. They are two separate different things. Okay. So the quick facts book, sorry, I'm at home. The quick facts book is literally just a book, Rosie. So if you have it, it's just questions and answers. All right. And then the virtual trainer is the whole complete system where you get the online videos, the homework, the practice exam, and you get a workbook to go along with it. So the idea is that you do both together, but because the quick facts book is just a book of content that you study on your own. And it's not even all the content because there's a lot of things in the quick facts book that you won't find. I don't go over delegation. I don't go over infection. All right. So what I was saying about this is that it usually takes about 3 to 5 days. It usually takes about 3 to 5 days for the books to get to you, whether you're international or whether you are locally. All right. And you have to be home in order to sign for the books. Okay. So can you guys hear me now? Thumbs up or thumbs down? Thumbs up. Okay, thumbs up. Okay. All right. So that's what I was saying about that. Also, if you already have the quick facts book, then you can get the virtual trainer for the lower price of $129 by just going to ReMarNurse.com. Just going to ReMarNurse.com. Okay. All right. So that was the question about that. And so that's all that I was saying. I was basically saying just that and just saying that I knew you guys couldn't hear me because of the comments. And so we were working on the sound. When you're at home, things tend to happen. Okay. All right. All right. So we're here now. Okay, so we're talking about that the sale ends for the virtual trainer this week. Now, I had some questions about the question bank. All right, so the question bank will be coming out not this week, next week. So that's set to come out next week. And that is the question bank that I've been getting all of my questions from and the ones that I've been working on for the longest time. And so we will be releasing that next week for you guys. Okay. Any questions about that? What else? All right. So if you, like I said, Team ReMar, we don't work. Today is Monday. And so we don't work. Our office is not open like Saturday and Sunday. So every email that you guys have been sending, Team ReMar is working on them right now as we speak. Okay. I have the DVD package, quick facts question. So how much do I pay for the virtual trainer? If you have the quick facts already, then the virtual trainer will be $129. Okay. All right. So in this, if you sent emails, make sure that you're emailing support@ReMar Review, because I see a lot of people and they're emailing the old email address. So if you're emailing the old email address and you're not getting any response, like in general, if you email me and you don't get a response from Team ReMar within like 2 days, especially if it's over the weekend, then you may need to check your email and make sure you emailed us. Okay. The question bank will be separate from the virtual trainer, because the way that I created it is that you can select the topics that you want to answer questions from. So I could not put it into the virtual trainer in that platform. Okay. So it is cultural competence, critical care in the RN, medical surgical, pediatrics, antepartum, postpartum, pharmacology, broken down into topics. Like it really will be selective. All right. The renewal of the question bank, the renewal of the VT is $69. And so if you don't see that price, just message Team ReMar and we'll get it for you. Okay. Yes. How much is the question bank? What's the price on the question bank? It'll be around $29.95 for my question bank. Seriously, you guys know, like, I want it to be a resource that everybody can get. So it'll be $29.95 for like 30 days in the question bank. All right. Yes. And like the question bank is a new product, right? So people honestly have been passing without the question bank. So don't worry about, like, if your test comes before then and you don't have access to the question bank, don't worry. People have been passing without it. Somebody asked about the question bank book. So I'm going to make the online question bank the same price as my question bank book. Like, I'm not going to raise that price at all. So the question bank book has, I think maybe like 400 questions in it for that price, $29.95. And the online question bank has, for RN, over 1,200 right now. And then the PN has, I think, about 1,100. So it'll be the same price. So you can pick whichever ones. All right. So yes, it will be available for you guys. And I know you'll love it. All right. Did the question bank have a CD? No, nope. It's just questions. The virtual trainer will have your content. The question bank will have the questions. Somebody says, wow, that is great. Absolutely. Yes. Is the question bank different from the question bank book? Absolutely. The questions are totally different. They are not the same at all. Okay. All right. So I got you guys with the questions. You don't have to worry about it. If you feel like you need to do more questions, like, the question bank is totally optional. It's not even something that you have to do. Yes. When will it be coming out? Next week? All right. So yeah, thank you. Yeah. Yep. So we're working on it now. We're going to make sure that we have that product up for you guys so that next week you guys can begin to order it. The cost is going to be phenomenal. $29.95. And so I don't know, like, listen, take advantage because that's going to be the introductory price. Okay. That's going to be introductory price for you guys. All right. So everybody's like, cool. Can't wait for it. Awesome. I know a lot of you have the virtual trainer. So you will be, you'll like the questions. And let me say something about the questions. They are challenging. They are meant to, there's a ton of select all that apply, they're challenging. They're made to test your content. Okay. So some of the questions I think you'll find, very straightforward. Like, okay, what is this? If you're in the fundamentals, I have two categories. I have a fundamentals and I have an integrated concepts. And I've never seen an integrated concepts portion in a question bank before. So I really wanted to make sure that I had that for you guys, because you guys know that integrated concepts can be anything, right? It's a portion on the NCLEX test plan, but it can be anything. And so I think that the fundamentals and the integrated concepts will be those refresher ideas that, we learned the first year of nursing school. And then, when you get into the critical care, the med surge, there's like there's over 300 just medical surgical questions. And those are really great. All right. So yeah. All right. Yes, I'll have Mark to send out an email about it when it's available to you guys. Oh yeah. Also, I have math. I have clinical math in my question bank. You don't have to pay extra for it. So dosage calculations and there's another name for it. I can't think of it right now. But yes, we have the math. And it's a ton of calculations. So I hope you guys are up for that. And they're fill in the blank. So the formats of the question bank are select all that apply, fill in the blank, sequence, and imaging exhibits as well. Okay. So I really, really, really hope that you guys will like it and that you will benefit from it. And most importantly, be able to go through it. Like, I didn't want to have so many tough questions that you guys felt defeated. I wanted them to be realistic for you. Okay. So how do I order the virtual trainer? It's simple. You can just go to remarnurse.com and that's where you can get your virtual trainer. You'll also be able to, get the question bank from there too. Okay. Hotspots. No, I didn't do in my question bank. I didn't do any hotspots and I didn't do any audio. And the reason why is because I'm prepping my products for the future of NCLEX and supporting the future of it. And if you listen to any of the things that NCBSN is putting out, or if you attended the conference, or if you got my notes from the conference, then you will understand that they have already blatantly said audio and hotspot questions do not test critical thinking at all. And so I definitely know that they will be moving away from them. And I didn't even bother to put any of that into our question bank. All right. But those select all that apply questions are there. Okay. Somebody says, how can we get the math questions? The math questions will come with the question bank. They will be their own topic. They'll be their own topic. All right. Okay. So the last thing that let's see, is there any more questions about that? All right. Yes, I have some. Oh, Saunders has integrated concepts. Okay. Saunders has integrated concepts too. Cool. And so with the question bank, remember guys, I had said this, with the question bank that's coming out next week, it will be for those who have the virtual trainer already. So we're going to put the link inside of the virtual trainer for you guys to sign up for it. Okay. So we're gonna do a private sale exclusively for those in the virtual trainer. That's why I'm telling you guys, get in the virtual trainer now. It will also be available to those who've had the virtual trainer in the past. So don't worry. You will be able to do it. You'll be able to get the question bank too. All right. Okay. So the last thing that I want to talk about is, of course, the gender reveal that we had yesterday. You guys have been so gracious to me during this time. You've been waiting, and you have been tarrying with me as I have been going through this third pregnancy. And so if you guys didn't know, we are definitely having a 5. The Mark said countdown. All right, I'm gonna tell you what we're having. If you don't know, put it on the screen. But we're having 5, 4, 3, 2, 1. It's a girl. We are having a girl, which I am totally shocked about, because I thought for sure that we were gonna have a boy. I was 100% sure that it was gonna be a boy. And when I got the news yesterday, and we'll play the video for our baby shower. When I got the news that it was a girl, I was shocked. I was so shocked and amazed. And it was just a feeling of overwhelmness, because I had in my mind prepared for a boy. So you guys had called it. A lot of you had already said that it was a girl. So you were right. Oh my goodness. And so Mark and I, we want to just thank you guys so much for all the support and the love that you've been showing. And so we're going to have a virtual baby shower just for our ReMar family. And Mark, actually, can you put the link? We did the Amazon registry and all that stuff. So we'll put the link in the video. And I just want to say that, when you think about going through pregnancy and still having the responsibilities, and that's why I love my ReMar community so much, because we're made up of real people. So like real nurses, real lives, real stories. And you guys share that with each other so freely. You guys share that with each other. Like, okay, this is where I am in my life. It's not easy for me, but I'm trying, right? I'm trying. And so being pregnant and sharing these days and these times with you guys really just helps solidify this community to me. Like, there's something very authentic about the ReMar family that people can get. I mean, and I'm not trying to be shady in any way, but other NCLEX reviews can get up in there and say, okay, but we're a family. Come join our family. But seriously, here at ReMar, we're really a family. We really are. We have these moments of connection. And so we're going to name our daughter. What's her name, Mark? Shiloh. We're going to name our daughter Shiloh. And so Shiloh means peace. The rest of our children, they have names that also mean peace. So we have Salome, and then we have Salim. And so this will be Shiloh. And this will be my second daughter. So I'll have 2 daughters and a son. And so, Mark and I are just so grateful that during this time, I'm healthy enough to be able to continue to do ReMar. During the coronavirus and everything, it's a very scary time to be pregnant. But God has, allowed me to continue my ministry during this time. So I don't know how much longer I can go, but I'm going to keep trying. Right now, I am 23 weeks. So I'm halfway there, but I'm really tired. I'm really tired. All right. So, yes, Shiloh is coming. Mark and I, like I said, we're going to do an event. We're going to do our virtual baby shower. We already have people that have purchased us things for baby Shiloh. And so we just want to say thank you guys for being so just supportive and amazing. Everything that we give to you guys, we definitely get back tenfold. Everything we give to you guys, we definitely get back tenfold. So be on the lookout for that event. I'm really excited about it. I've never done a virtual anything. Well, that's not the truth. This is virtual. But I've never done a virtual baby shower. That's for sure. So I'm really excited about that. And I'm excited to play the games, because it can't just be it won't just be like, if I'm doing it, it won't just be a virtual baby shower. Of course, I'll be doing NCLEX questions. Somehow you're going to turn it into an NCLEX review. Of course, I will be doing a pregnancy overview during my virtual baby shower. So I hope that you guys can join us. I'm probably going to put out a workbook for it. And just that's just how it's going to be. Yeah, we're going to play games. Okay. This virtual shower, we're going to play games. We're going to give away prizes. I want to give away. I love giving away cash. I love giving away ReMar products. That's just me. So we're going to play games and do all that fun stuff. So I hope you guys can attend. And like I said, I'll have Mark. Let me go to Facebook real quick. Absolutely. So I'll have Mark to get all that information out to you guys. Yep. Okay. All right.
So make sure you join us tonight for the last class of ReMar Nurse University.
Yes.
Going over nothing but the questions. It's going to be an amazing class.
Yep.
And I think I'll do a devotional and a prayer for you all with you all tonight as well. So
Okay.
Close it out, the right way.
Oh, that's going to be fun.
So I'm looking forward to the virtual baby shower and ReMar Nurse University tonight.
Me too, absolutely, because it's going to be kind of bittersweet because I think a lot of people didn't realize the ReMar Nurse University actually ends, and they thought it was just something that we would be doing every Monday for like eternity. So this actually will be my final class until next year for ReMar Nurse University.
But you're going to still do the Monday motivations and how to pass NCLEX for the short time.
Absolutely, as long as I can. Yeah, until I take an official maternity leave.
You deserve it.
Thank you.
For sure.
Thank you. We will continue on, with our custom of doing Monday NCLEX reviews. So let's see here. That's it. Whitney says, I passed my NCLEX last week, but joining RNU tonight.
Love it. That's awesome.
That is awesome.
At the beginning of RNU, that if they started at that time with RNU in May and that they would be able to pass NCLEX and have their license by now. And so, the sale ends on Friday. So guys, listen, it's an amazing opportunity. Nurses are passing every single day. And so this is your time. This is your opportunity to pass NCLEX.
Yeah, that's awesome. That's so awesome. So come on with your wisdom, share, comment, just provide any kind of encouragement. You just passed NCLEX. So you're very valuable, to everybody because we want to get to where you are. So 8:00, we have Mark and I have a lot of work to do actually between now.
5 more hours. Got to send the emails out, the notifications, get the PowerPoint up.
Yeah, we got to do everything.
But it's going to be there for you to get you the motivation.
We're going to get it. We're going to get that. We're going to get that class in, this final class for you. And then, so Mark, you have to be ready for your part.
So listen, make sure you've done your questions in the workbook.
Oh, yeah,
Because you're going over those 10 questions.
Yeah.
Make sure that you have done those questions in the workbook so you can discuss them tonight with Regina Live.
Yeah, because you guys know that, the other ReMar Nurse classes have been pre-recorded, right? So they would be pre-recorded and we just, release them to you guys. But tonight we will actually be going live. So I'll be a live event for you guys. So I'll be able to answer all your questions in real time and just pray for us. Just keep us in your prayers until that time that everything works out and we're able to present ReMar Nurse University, the final class
and
to you guys.
One more favor to ask you guys. I see a lot of you saying, hey, listen, I'm getting it Friday. I'm going to get it Friday. I'm going to get it Friday.
Oh, yes.
Friday is the last day of the sale. And if everybody on here gets it Friday, there's going to be like a bottleneck or logjam. It's going to take a little bit longer to get your materials. You know that, but I just want to tell you once again. So if you can get it, today, tomorrow, Thursday, Wednesday night, Thursday night, do yourself a favor and we'll get it out to you super quick. And then we'll, of course, try to process it as soon as possible. Yeah. But we don't want you to be disappointed, especially if you're testing soon.
Yeah.
Go ahead and get your order in for sure.
Absolutely. So long story short, if you wait until the final day to get the VT, it may take you up to a week or so to get it.
5 to 7 days.
Yeah. So period.
Get it in now. 3 days. It'll get to you. Last minute. It'll take a little bit longer.
Okay, Maisha says, I was near passing in all of my categories, but was above passing for pharmacology. Shout out to ReMar University Pharmacology Review. That's right. That's all right. And you know what? And that's what it's about, Maisha. Just studying those areas and you will be able to. You will be able to. Absolutely.
Marie asks, is the VT enough to pass NCLEX? Is the VT enough to pass NCLEX? Absolutely. We've seen testimony after testimony. It has the content that you need. It has enough questions to get you through.
Absolutely.
And so it is definitely enough to pass NCLEX. If you want to take it to the next level and add some additional questions, see a lot of you are studying with, maybe with ReMar and UWorld or ReMar and NCLEX Mastery and adding these additional questions, resources. So we wanted to be able to support you in that as well and also help lower the price for you as well.
Yeah, absolutely. So the virtual trainer price and the online question bank will be available. That price is crazy. That price, $29 is crazy. So I hope that we can all, get it. Somebody says, my book came in Friday. Ray says, my book came in Friday. I can't wait to start my VT today. Get in there. Get in there. Shakita, am I saying that right? Shakita says, I'm ordering mine today.
Lois says ordering tonight.
I'm telling you, order because
somebody's staying in VT right now.
Only because too, our offices are closed. Our offices are pretty much still closed because of the coronavirus. We're in Ohio. So although they're gradually opening up things, you guys know the restrictions are crazy in order to keep everybody safe. So we still have our offices closed. So we have shipping, just like, several days of the week, but it's not like full time like how we would like it. And so not quite there yet, but definitely get your order in before this sale. Friday. Yeah, that's all I got to say. Just before Friday. I can't say that.
And somebody's asking, if I have the VT, how long will it take? How long before I can take NCLEX?
You know what I was saying in the beginning, it was a 6-week program, 6 weeks, which that's how I wrote it. It's traditionally a 6-week program. That's how I do my NCLEX reviews. But we've had students who have studied the virtual trainer in 2 weeks.
Yeah.
It blows my mind. 3 weeks. And they say they studied it in 3 weeks and passed. There was a comment on here from Amanda. Raymond says, I got it on Saturday and I'm already in the 2nd week. So.
Wow. Yeah. That's what, 3 days, 2 days, 3 days.
And so that just speaks to, I think students, they enjoy studying. When you enjoy doing something in the virtual trainer, you enjoy studying in the VT, you do it for longer periods of time. That's just the truth of the matter. And so for somebody to have had the virtual trainer only a couple days and you're already in the 2nd week, that's just amazing to me. It really is. It really is amazing to me.
So you can finish in 3 to 6 weeks, but make sure that you're comfortable with the material. If you have a deadline that's coming up and you have to test really quickly, go ahead and push it. It's it's okay to reach that deadline. But otherwise, you want to be at a comfortable pace and know that the VT is going to be there to support your studies.
Yeah, absolutely. So we have so many comments. We were saying, I'm loving the virtual trainer. I feel comfortable taking the exam. Amanda says she lost her job, so she's studying full time. Okay.
Put that work in.
Yeah.
That's awesome. All
right. Prepare for your new job. It's coming. Coming. Okay. All right. Somebody says, she says, I have you world. And VT, I should have just gotten ReMar. Yeah.
A lot of people are saying that now.
Yeah.
Here's a question. It says, how long after you finish school should you take the NCLEX?
After you finish school?
Yep. How long after you finish school should you take an NCLEX?
As soon as your paperwork is ready, as soon as that paperwork gets in, set a test date because you are in a great position. If you have a study system that you can be following to get your license and pass, because you know what? Also, they're still canceling test dates. So you want to make sure that you can secure a test date, have a focus, have a plan. So when your time comes, you're not anxious about it. Okay. Nope. So pharmacology tonight, we're just doing the final 2 pages. Yeah. The final 2 pages. All right. So somebody says, I got my VT on Friday. When will I get my book? So if you ordered your virtual trainer on Friday, remember the office is not open Saturday or Sunday. So it should be going out today. Yep. Okay. Today is Monday.
And also just to remember, if you are an international student in terms of if you live outside of the United States, make sure that you select the international package. So that way you have your shipping costs are included in that order.
Absolutely.
Because if you don't select the international package and your address is outside, then we have to contact you. We have to send another invoice and then make sure we have to have that exchange. And that can delay the time in which you get your product. So if you live outside the United States, select that international shipping package.
Okay. Lily says, what is your baby's names? What is all of my baby's names? So my oldest daughter, her name is Salome, Salome. Her name is Salome, and that means peace. And depending on where we are in the world, some people will call her Salome. Some people will call her Salome. But we pronounce it Salome. Our son's name is Salim, Salem. His name is Michael Salim. So Salim means peace. It's like Jerusalem. But we just call him Salim. And then the girl, her name is Shiloh. So Shiloh will be spelled Shiloh, Shiloh. And so that means peace as well. All right. So we are excited about Shiloh coming. So she has a lot of love already.
Mm-hmm.
And hopefully she adds to the peace of the house because we'll have 3 children.
Yeah.
But they are 3 very normal children. So they love to play and they are very loud. So we need another peaceful
presence.
addition.
Yeah.
Yes.
Yeah.
Shakita says so many nurses here in South Carolina used your program. Awesome.
Here's a question. Says, what is the VT?
What is a VT?
What is a VT?
What is a VT?
So a VT.
VT is slang.
Is a virtual.
That's
trainer.
what you guys call it.
It's a virtual trainer. So Regina is the trainer, and you are being trained by her virtually.
Yes.
Through your phone, through your laptop, through your desktop, and you have a workbook, study guide that you use with your virtual trainer. Right.
Mm-hmm.
And so it's just like being in the classroom, but you're doing it from your home, from your cell phone. And Regina is the virtual trainer, and you use the virtual trainer on your phone and your workbook.
Oh, okay. Yes, absolutely. So it's like having me in your home.
Yeah.
So many comments on the babies' names.
Yeah.
Somebody says Salim is a Muslim name, right? So Salim, I guess it is a Muslim name when it's spelled like that. Yeah. We try to have all of our kids' names in Hebrew, like we get them from the Bible. So as well.
Yeah. Because it has the common language background.
Yeah. That's pretty cool.
Yep.
We have a Salome on here as well. She says, I'm a Salome.
Nice.
So that is really cool.
Yeah.
Yep. And peaceful. Pretty names. Beautiful. Cool. Yes. Okay. Is there an app for the virtual trainer?
The virtual trainer, you use it on your phone just like an app.
Yep.
You go to the website and you log on, and it has all of the same functionality, but you have to be connected to your Wi-Fi or the internet in order to use it. But you definitely, it's mobile ready.
Yeah, they do. Yeah. So it's very easy and convenient to use. They could take with you. Lauren says she's going to name her daughter Brielle, which means God is my strength. I like
beautiful.
That. Very beautiful.
And sometimes you really just need some of those reminders.
Yes.
You know what I mean?
Yeah, just presence. So,
yeah. When you get mad, you say, I'm so bad right now, but God is my strength.
Yeah, I like that.
Yeah.
I like that. Another Salome too on Facebook.
Oh, beautiful.
Yeah.
Somebody
named their baby Genesis. Somebody
hold on, let me see. That's my church's name, Shiloh. Betty, are you in Chicago by any means? Are you in Chicago?
Yeah. Okay.
Let us know, Betty, if you are in Chicago.
Okay, guys. So we're gonna get out of here, and we are going to get ready for tonight's class. We have ReMar Nurse University coming up as well. Lots of great things for you guys in store. I'm looking forward to wrapping up ReMar Nurse University with you guys, getting you guys in the question bank next week, and then just progressing on. Again, join my virtual baby shower event. I'm gonna have Mark create the event, and I want to see you guys there. We're gonna have a maternity review, free prizes, free giveaways. So we'll be doing that in a couple months, but I want you guys to sign up for it now because we may be sending out some things in the meantime. Okay. All right. So can, will, must pass NCLEX. So we will see you guys later on tonight. Bye. Awesome. Yes.
Really fun.
Yes. We'll see them tonight. All right.
See you later, guys.
Bye. Yeah.